All right, our next presenters from Australia, this is WalkScan. We have Michael, see what happens? You psyched me out of it. You were so smooth in the first three presentations. Sorry about that. All right, let me try it again. We have Christopher Michaelides and Armin Aldali.
Good morning, everyone. I'd like to introduce to you WalkScan. We're from the University of Technology, Sydney. I'd first like to introduce the problem. The way we see it is that there's individuals out there, like Catherine, who are an elderly lady. She's experiencing minor symptoms of a disorder that's not yet diagnosed. She has a fall, which is common because balance is a symptom, and injures herself. That is a result of a late diagnosis and late treatment and intervention with drugs or direct brain stimulation. And for us, we believe that early intervention leads to better outcomes for patients. On the left here, we have the problem here, and what we see is on the left is what doctors are experiencing as problem. There's no early detection for Parkinson's disease, and there's no definitive diagnostic test. And they're costly. And the actual machines, the MRI, the CAT scans, are very capital intensive. And there's also a delay in the analysis. If a doctor or a patient is lucky, they might get it on the same day, but usually it takes 2 or 3 days to actually read and analyze that. And there's no known cause yet for Parkinson's disease. On the right, we have the problems for patients. Each individual analysis by the imaging system is costly, and in fact, it's inconclusive. Which leads to poor outcomes, especially if you need regular testing to manage the drug intervention. It is also highly invasive and uncomfortable. It's a poor patient experience. It's claustrophobic, it's away from their houses because it's so capital intensive, and there's that risk of radiation as well. And there's a problem with scheduling because these people live in it's a group asset, so they have to schedule it and it's in high demand. And again, there's no cure for Parkinson's disease. Our concept actually combines 3 elements together. The first is in the health. We use big data, and we wanted to affect something that had global scale, and it's that intersection in the middle where the idea of WalkScan originated. It is our goal to achieve earlier detection of Parkinson's disease. And our core strengths, the founding team, myself, I have an expertise in business development. Armin is our enterprise system engineer. And Sadra is a specialist in big data analysis. Our solution. Essentially what we do is provide analytic software that aids the diagnosis of Parkinson's at an earlier stage. Now we do that by charging per report, much like an X-ray or a CAT scan would pay for the per analysis and report. And what we were really bolstered by the fact that 5 days ago, Todd Scherer, the CEO of the Michael J. Fox Foundation, which specializes in Parkinson's research, said that big data analytics could transform research and treatments for patients. And therefore, our solution is using motion capture and leveraging big data to analyze patients at their first point of care, essentially their general practitioners. And this is how it works, quite simply. What we'd like to show is, the idea is we have a multi-factor model. Over 40 parameters go into our algorithm and our analysis software. This is just one factor of it. And what it is the stride wave. We call it the W wave. As you can see, I might demonstrate a normal, healthy walk scan. It is a normal rhythm and pace and difference. And also, you're moving quite quickly and you're moving with great mobility because the symptoms are rigidity, it is balance, and it's also a limit with the mobility of the patient. Now, the difference is a Parkinson's walk scan would exhibit just this one factor is in the stride. They're short, shuffled, The foot is not raised as highly, and at the same time as well, you're experiencing a shorter frequency. So if you can see the pitches, there's more pitches in frequency, and the depth is also shallower. And that's because they're experiencing a restriction and they're experiencing less mobility and a shuffle. And that's just one factor. Our algorithm actually contributes over 40. This is what we see the customer need. Our customer is the doctor, and the doctor at a first point of care in an individual practice or a group practice. And we see the customer need is earlier diagnosis. A good patient outcome is the same as the need for the doctor. In-house service revenue, this actually allows the doctor to provide an extra service stream, because they're actually conducting the analysis, the imaging themselves, and sending the analysis to us, and we sell the per report analysis to them. It's also more available, because at each point of care, a customer can go to their convenient, who they're accustomed to. They've already built that patient rapport with the doctor, and it's at a more convenient location. And it's the cost of service. So a CT scan for just low contrast is going to cost $300. With and without contrast costs the patient $500. An MRI with low contrast costs $550. With low and high contrast costs $1,000. These are extreme costs. And the cost of service for us, and we'll get into that in the business model, is only $59 for the analysis report. And it's ease of use. It's a one-time calibration, and you don't need to recalibrate it between patients. It's as easy as you can see here, the Connect system. You put it on a tripod, or you could have it fixed. It's capable of tracking 2,000 facial points, 25 body points, and it's sensitive enough to actually detect someone's heartbeat. And this is actually made already. It's an established open platform by Microsoft. It was initially introduced for gaming, but they've actually encouraged industry to leverage this hardware and apply it in industry applications. So the hardware itself, we'll be purchasing through an agreed supply agreement. We don't actually make the hardware. Our business model focuses on a per analysis report. The market sizes as we see it. The statistics are all based from in the US and Australia. We see that as our first target markets, and we want to focus those for our market capture. The peak is the already diagnosed Parkinson's patients, and that's at 565,000 in Australia and the US. The high-risk patients, and that number is 715,000. The way it works is a diagnosed Parkinson's patient at 565, 20% of people who have Parkinson's, a relative, 20% of those relatives will also, the link there, the genetic link, will actually eventuate into them also having a diagnosis for Parkinson's, as well as the number of people who are undiagnosed. And the general patients. Now, what we've done there is 340 million is the population of the US and Australia. And what we've done is actually applied the curve, the Rogers innovation curve. And what it says is that the way it works is innovators, that's early adopters, as a new technology is introduced. So we're a new mover in this market. We're the first player, and we've applied the 2.5% of innovators. So Rogers said that 2.5% of innovators will take on early technology. Therefore, the diagnosed patients will be tested and then the analysis report on a monthly basis, the high risk at a quarterly basis, and the general patients will be yearly. So we've extrapolated that out and looked at the number of scans. So the whole market size is 8.1 million, and it ranges to a 5% capture of 900,000. And at the $59 price point, you can see that extrapolated total market size. We'd like to look at our intellectual property, and we think that's really our gem. What we have, initially, we've actually filed a provisional patent in Australia, and we'll be actually, within the 12 months allowable, file under the international PCT, under our initial priority date in Australia. We also have the WalkScan trademark and the walkscan.com domain name. And the WalkScan trademark is under Class 9 for software and Class 44 for medical services. And it's our proprietary software copyright. And that's very important. No other party actually sees or controls our software copyright. It's an in-house system because we conduct all the analysis. And that's very important because that holds our analytic. We'd like to show you the competitive advantage. And what we've done here is compared WalkScan with essentially CT scans and MRI. Now, we're first to this market. We're the first mover. And although we have no direct competitors, this is essentially the alternative. So that's the closest we can show you for competitive advantage. And we've taken a number of things here. And you'll see on the left is a score out of 10 for WalkScan. On the right is a score out of 10 for the competitor. For early diagnosis, we have 8 out of 10. Because we can actually, with our algorithm, predict the likelihood of getting of Parkinson's much better than the CT and MRI, because it's inconclusive. With accessibility, the cost of this machine at retail is $199, but with our bulk agreement that we allow our distributors to leverage, it's a much lower rate compared to tens and hundreds of thousands for a large CT scanner and MRI. The price, again, $59 for a report in comparison to the $300 to $1,000 for the CT and the MRI scans. Asset cost as well, very low compared to the large cost. And the patient experience is what we're really pushing, because we want our patients to be our champions that take it to the doctors and say, I want a WalkScan because I want to make sure that I detect Parkinson's earlier so I get a better outcome. So we think the patient experience is important. What we do acknowledge is customer familiarity and referral relationships. We would be foolhardy to not acknowledge that MRIs and CT scans are the more established technology. There are those pathology labs and imaging services have already established that referral relationship. And as well as that, they've also, customers are familiar with the term CT and MRI. We think that with our market capture and our growth, WalkScan will become just as commonplace as MRI and CT in the minds of patients and doctors. And scalability. Because we're offering an analysis service, we think we're infinitely scalable. The software drives the outcome. The analysts and the tech support merely monitor it to make sure it's delivered at the standard we require. Our business model, and we'll show you step by step. First, WalkScan. WalkScan has actually established a relationship with Rackspace in a cloud server. It's at a HIPAA-rated server, HIPAA being the standard for medical confidentiality and privacy. Our data is encrypted and anonymized, but it's important that we communicate that it is a HIPAA-rated service because we don't want any medical breaches. But again, it's anonymized. It's an extra security. We've also will be establishing a supply agreement with Microsoft, the makers of the Kinect system, and a bulk price. And we do that to allow distributors to actually purchase the Microsoft directly from the Kinect from Microsoft, and allow Microsoft to drop ship the Kinect directly to those distributors in the region. And that's important because we want to keep our balance sheet as low on assets, and we don't want to manage any inventory. So by allowing drop shipping, we're staying very light in that manner. Now, the doctor and the distributors will be establishing the relationship, and he'll be delivering the Kinect system with an easy calibration and setup, as well as we'll be providing them a sales kit to make that introduction a little bit easier. The doctor pays the distributor directly. It's an at-cost relationship. For us, the business model is in the per analysis, and it's not in the sale of the hardware. It's such a low-cost device that we're actually focusing on the volume through analysis. Now, looking at the patient provides a service, and they pay that patient directly. If we can go to, and again, the cloud service, they pay the money to the WalkScan and then delivers the report. Our marketing channels, our doctors are our key markets. They're our key customer. And we're going to get to them through the CEO of Parkinsons Australia and the general organization has committed to a partnership relationship with us. And they will obviously be advocacy for the patients. Shake It Up, which is a research organization partnered with the Michael J. Fox Foundation in Australia. And we also would like to attend medical trade fairs, and especially Medicare. Medicare is the Disneyland for medical professionals. And that's the access we're going to get through our distributors and doctors. And the distributors will also push towards the doctors. Looking at our financial forecast, there's a lot of numbers there, but I'd like to just highlight a couple key points. Because we're so highly scalable, the margin is 80%. We're looking at 858 doctors, and that identified the cost, the operating income, and retained earning. The funds required is only 247 because it's all retained earnings. And if I'd like to bring you to the last slide. This is just our analysis report, and if you can just progress forward. It's just our entry and our growth and exit. It's a very simple, it's doctors first, establish the proof of principle, and actually exit by selling it through providers, through essentially our competitors, our imaging and our pathology labs. And our team and our advisory committee, And that's WalkScan. We'll be open to any questions.
Thank you for your presentation, and thanks for the plug for Rackspace there. Appreciate that.
Great provider.
I had a question. Have you done any talking to insurers to see if they would be willing to cover the cost of this for the patients?
We haven't directly spoken to insurers, but we've actually looked up in Australia the HCPCS, which is essentially the Medicare provider number. The cost, the way it's structured, as I mentioned, 300, 500 for CT, 500, 1,000 for MRI. The way it works is 80% is covered in America for the cost of that. 20% is the copay for those profits, for those the difference, and there's a $147 yearly deductible. The cost is so low, $59, it'd actually be covered under the analysis software portion because it is a diagnostic service and imaging system. So it follows under that HCPCS.
Two parts. Where are we videoing?
Could you repeat that, sir?
Where are we videoing? Where are we video?
Oh, it's actually at the first point of care in a doctor's practice.
All right, so I think you said 20-some facial points, and I think it was a less number of walking points.
Yeah, so there's 2,000 facial points and 25 skeletal points.
Okay, so, all right, why are we videoing as opposed to using monitors on the person?
So what you're suggesting is the marker system as opposed to markerless. So the Connect system is markerless as opposed to what you'd see in video games or or sports stars where they wear the white baubles on their key points. One, it requires calibration. And the doctor needs to be as easy as an on-off operation, and that's what it is. The system only requires it on, it detects movement automatically, it tracks the skeletal points through the inbuilt development kit, and at the same time, it switches off when there's inactivity in front of it. Essentially, we want to make it as easy for the doctors to operate it because they're going to be the one providing the imaging. But it is foolproof because the system's so developed and it's so sensitive. I mean, it can detect a heartbeat. So the level of sensitivity is very high.
Sorry, in addition to that, we use gait analysis, and our algorithm is based on gait analysis. So we use gait analysis, the research, to follow the walk of the patient to see if they have the symptom or not.
The projections that you had were both Australia and the United States?
That's right.
So talk to me about the regulatory regime this would need to be proved under, both for Australia and for the United States.
Okay. Well, this is not a medical device and would not fall into a category 1 regulatory. It would require no regulatory approval because it's purely a diagnostic service. But it's very important for us to develop, to build the trust and competency in this medical market. Reputation and accuracy is the key drivers. So although there is no regulatory hurdle, there is actually further trials that we'd like to do as we capture more data, and that's what that relationship with Parkinsons Australia and Shake It Up would provide, that clinical data through our trials that allows us to further calibrate the algorithm and make it more accurate than it already is.
Yes, so that was my next question. So talk about the clinical trial that you need to run to prove to people that this works, because realistically, without significant clinical data, I don't know that even doctors would believe it.
Yes. So the way it works is we've been very lucky that the Michael J. Fox Foundation has already made available a data stream that we've actually matched our algorithm, tested the accuracy of our algorithm to that already available clinical data stream. That's publicly available, and you can access it through their website and download it. It's a very large download, I warn you, but it's already established. Now, that's only a 5-factor model. They use an accelerometer for a number of people who already exhibit Parkinson's symptoms and those who don't. And we've actually applied our algorithm to that simple data set and received an accuracy of greater than 85%. The fact that our factor algorithm is more than 40 parameters means that once we build our own clinical trial system by leveraging the technology in our algorithm, it's going to reach a much higher accuracy rate. And that's what we'd like to do with the trials. I mean, ideally, our market capture is to allow Parkinson's New South Wales, Australia, and Shake It Up to support by releasing clinical trials, medical reports, because that's really how doctors get that credibility that that's been publicly reviewed by peers through established trial scenarios.
So I'm picturing, so this system is able to detect how many facial points?
2,000
facial points and a number of different other points on the human body. So I'm picturing a huge amount of data that goes in, and then there's only one thing that comes out. Either yes, this person is going to have Parkinson's in so many years, or can just, or something like that. So it's either yes or no is the output. Is that?
I'm sure Armin and I would love it to be that easy. It's much more complex. The report that we actually give is an analysis of that data stream in a pictorial manner, showing the key factors. This is not a purely diagnostic system where there's a yes/no. It's a percentile outcome from a range of 0 to 100% of the likelihood that the person exhibits the Parkinson symptoms, 100 being most definitely, 0 being 100% not likely. The report system has obviously the executive summary on the first page, but it's a much detailed outcome, and it still requires a doctor to apply their technical experience and prowess and their examination of the medical history of the patient. But it provides much more conclusive outcomes for doctors to make better calls, and because it's frequency-based, so it's cheaper, so you can do it on a more regular basis. So it allows you to monitor drug intervention, the levels, the types of drugs. And that's important because that affects patients' outcomes. Because Parkinson's degenerates so quickly that the more testing, the better. Because you can actually fine-tune the drug intervention. That leads to less side effects as a result of the treatments.
So the secret sauce, if you will, in your plan is the algorithm that you have in crunching all this huge amount of data. So where did you come up with this algorithm? I'm looking at your folks on your team. Are any of them medical experts? I didn't. So Parkinson's experts, because I would imagine that's a pretty sophisticated field.
Well, what we've done is actually taken our core team from, and we are currently looking for a doctor and neurologist in that specialty to actually assist us with that development of those key points. But luckily for us, that the factors that we've applied and the availability of the data stream and the academic papers on key Parkinson's symptoms, we've been able to extract an algorithm that is able to successfully predict 85% based on that single Michael J. Fox Foundation. So that really the proof is in the pudding. With more parameters, we're only going to get more accurate. But yes, we definitely acknowledge that a key core competency we're looking for is a neurologist. However, with being an early stage venture, we'd like to take that person on board closer to the market entry to minimize on our variable costs.
Well, you might want to take it early because the whole key to your success is proving that you actually can do this. So. Yeah.
I mean, the benefit as well, with our partnerships with Parkinson's Australia and Shake It Up, we can actually leverage their in-house neurologists as well. That's the benefit of that strategic alliance. But of course, we'd want our in-house person to secure our proprietary analytic.
I guess one quick question to follow up with Dan. Have you thought about approaching some of the pharmaceutical companies that are making drugs for Parkinson's to show that with your technology, the treatment actually is working, so the effects are reduced? That may help you gain some traction with acceptance also.
We'll definitely take that on board. It's not something we considered, but that's definitely a target market that would help us with marketing channels.
Okay, yeah, a couple questions here. So, what studies have been done to validate the accuracy of your diagnostics?
So we've actually conducted our own studies, as I mentioned, based on the Michael J. Fox publicly available data stream, but at the same time, and with an 85% accuracy. But themselves, Michael J. Fox Foundation has recently, 5 days ago, announced that they're using accelerometer technology. Again, it's a much more simplified method, but it shows that that market is being, wearables and motion capture and big data is definitely something that the industry is capturing and focusing on, because that really is the solution to early detection and finding a cause.
And if you, this follow-up, I guess, to the next question. So if you do detect Parkinson's early, what can the doctors do about it?
Okay, well, there's been a recent academic paper in the medical journals that say an earlier intervention using direct brain stimulation rather than drugs can actually greatly improve a patient's outcome and health. So direct brain stimulation is actually a paper written by the neurologist that we're approaching. He's a University of Queensland Australian professor, an expert in neurology and Parkinson's. So I guess the next phase is making that the standard, direct brain stimulation. But the earlier you can do it, the better the drug intervention, which means better outcomes. And that's really our end goal.
Okay.
And in addition to that, we hoping to use our big data to find the cause of this symptom and help to find a cure for it.
Okay. And I guess one more question. Is this something that potentially could be used at home?
Technically, yes. I mean, we did initially focus our market capture on doctors, but nursing homes would be a potential further market because obviously they're living in a group environment, and with a fixed, you've got a large number of users. So yes, definitely, it can be used in a home environment. But again, our initial market capture is doctors directly.
Okay. Thank you very much.